Today we're going to be talking about TMJ disorders, or otherwise jaw pain and dysfunction. Hi everybody, Dr. Brittany here at Bloomington Wellness Center, and today we're going to be talking a little bit about disorders of the jaw and why you get jaw pain, and also what your chiropractor can do to help you with some of that. So your TMJ is the joint that happens when this bone called your mandible or your jawbone connects to this bone called your temporal bone of the skull. So there's one joint on each side, and then right where that hinges when you open the jaw, there's a disc on the inside. There's lots of different muscles and ligaments and tissues that help connect this bone to your skull, and also lots of different things that can go wrong and start causing pain in the area. For most of us, what happens that starts to cause pain is we tend to grind our teeth either at night or when you're stressed out during the day and you tend to clench your jaw. Other things such as dental work can sometimes cause these problems if you open your jaw too wide, or trauma to the jaw and sports and things like that can also start to cause problems in here, or even something as simple as if there's arthritis within the joint and then that disc starts to shrink, that can sometimes give you problems with the jaw as well. There's a couple different things as far as a chiropractic standpoint that we can do to treat some of this. The first thing that we'll usually do is just evaluate the movement of the jaw. So Christy, I'm just going to have you slowly open your jaw as wide as you can. Go ahead and close, and as you can see, when Christy's jaw opens wide, hers deviates to one side, comes all the way back. And as she pointed out earlier, there's lots of clicking and popping and all of those unpleasant things happening when she does that. So the first thing that I'm going to do with that is just evaluate some of the tissues in this area. And then for Christy, what I would do is take some time to really do some manual work on some of these trigger points she has in the muscles of her jaw. This one is called your masseter, and this is the muscle that we all clench when we chew and when we bite down. So in a lot of us, this can tend to get tighter on one side versus the other, and then can pull the jaw to one side or the other when you open and close your mouth. Aside from that, if the jaw deviates to either side, Christy, I'm just going to have you relax your jaw as much as you can, just let it rest slack. There are a couple of really gentle adjusting techniques we can do for the jaw, which again are just going to kind of reset how the jaw is sitting in its socket. And again, most of that feels pretty good. It's pretty painless for people. Aside from that, if you're somebody that stress causes you to do a lot of clenching and grinding of your teeth at night, there's lots of different supplementation we can do to help relax your muscles. Acupuncture is another huge thing that we often do to help relax some of these muscles of the jaw. So when we combine lots of those treatments together, that often helps release a lot of this tension in the jaw and then helps us reset the area that the bone is sitting in, which then can usually provide some pretty immediate relief for most people. One other thing we're also going to address is the different muscles and joints in the upper cervical spine and the upper thoracic spine, just because there's lots of different muscle connections that happen from your upper back into your neck and up into the skull and in the jaw. So we want to make sure that we address all different points of your system to make sure that we get all these joints functioning properly. If you have any other questions, please feel free to leave us a comment, and otherwise please feel free to share this video with your friends.